Our next speaker, she's Sinna Bolly. She's president of the Mauritanian Association for the Fights Against Tuberculosis and AIDS in Mauritania. And this organization was created in 1997 and always prioritized the fight against tuberculosis and AIDS. Mrs. Sinna received a World Award on tobacco control in 2008. And I would like you to tackle the issue of tobacco control and implementation of laws. And Dr. Sinna really battled hard for the implementation, for the creation, adoption of strong tobacco control law in 2008. I would like you to share your battle for tobacco control in your country, in Mauritania. So you have the floor, Dr. Sinna.
Thank you so much. The adoption of the draft law on the tobacco control by parliamentaries mean that we had to have a strong struggle. So parliamentary women of Mauritania organized themselves and it showed the combativity of Mauritanian women. So since the beginning, parliamentary women started to participate in each meeting we had with politicians. They did not hesitate to force doors to find appointments, and they accompanied ourselves. They were noticed during their intervention for the defense of the population against the evils of tobacco. And among many women who supported us, I would mention the mayor of Tabahena, a very influential woman and fervent advocate of tobacco control. She has even declared her city hall a non-smoking area. And during the celebration of the Independence Day in 2017, located at more than 700 kilometers from Nouakchott, we participated in a strong mobilization of women, community-based, and particularly women's cooperatives. They have formed with us and the network of women parliamentarians a hedge of 300 meters with banners and signs denouncing the lack of anti-smoking law. It was impressive to see all these women dressed in white under the burning sun, under 40 degrees. They stayed there from 9 a.m. to 2 p.m. And they wanted to make this trip to let the highest level know the emergency of an anti-smoking law. It was precisely after this action that the draft law made its appearance in the parliament, and the network of women parliamentaries kept on working on it. At all the steps before the vote to avoid its funding and disappearance. And the network, despite this progress, they continue to work for advocacy and awareness at the AMALUTS for the adoption of the law. But as the tobacco industry continues to carry out actions of corporate social responsibility, like creating health structures, helping institutions, offering scholarship to young people, and sponsoring cultural, artistic, and social activists, although this is prohibited. Therefore, we have agreed with the women members of our parliamentary anti-tobacco group to ask for the support of religious leaders. In Mauritania, the religious leaders is a moral authority. It's very much listened and followed by Mauritanian population in all its diversity. They have a strong mobilizing capacity of different public and influences, and they can influence decision makers. And they have a strong influence at the level of social, administrative, and political hierarchy. I cannot end without mentioning and thank the foundation, the capacity building in Africa Foundation. It's technical, financial, and memory support during this whole process. Without it, we would never have been able to continue and complete this project. I will never forget the words of encouragement of Miss Susie Limbepe and Bettina Louisa, and the small SMS and message sent by Mrs. Dildu Camara, and we made it. This is how in June 2018, we actually made it happen, and now we have our own anti-tobacco law. Thank you so much for giving me the opportunity to present this experience.
Sinna,
thank you so much, Dr. Sinna.